Hi, my name is Emily Parrish,
And I'm Barrett Thomas.
and we're doing a presentation for IEC522 on propionic acidemia. Propionic acidemia is a rare metabolic disorder characterized by a deficiency of an enzyme involved in the breakdown of the chemical building blocks of certain proteins. Symptoms most commonly become apparent during the first weeks of life and may include abnormally diminished muscle tone, poor feeding, vomiting, lethargy, excessive loss of fluids from bodily tissues, and episodes of uncontrolled electrical activity in the brain. Without appropriate treatment, coma and potential life-threatening complications may result in rare cases. The condition may become apparent later during infancy and may become associated with less severe symptoms and findings. Propionic acidemia is inherited as an autosomal recessive trait.
The prevalence of propionic acidemia is 1 in every 35,000 live births in the United States. The condition is not as common in the United States as it is in some other countries, for example, Saudi Arabia. Also, the prevalence is high in Amish and Mennonite populations.
Most states require all babies to be screened for propionic acidemia before they are discharged from the hospital. If infants are not screened in the hospital, many are diagnosed after they start showing symptoms of the conditions. When a child vomits, has poor feeding habits, is dehydrated, or has irregular muscle movements, they may have significant electrolyte abnormalities. The accumulation of free organic acids increases the anion gap and may indicate propionic acidemia. There are numerous tests and procedures done to find out whether or not an individual has propionic acidemia. The bone marrow of an individual is studied because free propionic acid is known to suppress bone marrow. Blood samples from the patient show amino levels which assess the overall metabolic status.
Implications for families. Families should be aware that PA is not contagious and that it is a genetic disorder, unknowingly passed down from generation to generation. Illness, cold, flu, viruses, etc., stress, dehydration, lack of calories, and constipation can cause metabolic instability. Thus, it is important that children and adults living with PA should have clean surroundings and appropriate diets. During these times, caregivers will want to speak with physicians about further restrictions in protein or a trip to the ER for an IV hydration and monitoring. Some children with PA are more prone to elevated ammonia levels, pancreatitis, and cardiomyopathy. Research is currently being developed because we know little about PA. It should be noted that children do not outgrow PA. It's a permanent condition. Newborns are always tested for PA.